Most personality disorders are, really a product of survival mechanisms that these individuals have learned to utilize from a young age in order to really get by in their troubling situation. Hello, my name is Veronica and I'm a therapist. Today we'll be discussing personality disorder basics. In today's society, personality disorders are really gaining traction and being discussed more and more. Media has its own representations of personality disorders, the most popular typically being antisocial personality disorder, given that it is the personality disorder that make up serial killers and are usually portrayed in movies and shows like Dahmer and the Ted Bundy tapes, and they represent personality disorder to this extent and pique the interest of the masses. Additionally, we have borderline personality disorder, narcissistic personality disorder that have gained much traction as well on social media. There are a great deal of misconceptions regarding the disorders and their criteria and the differences between the disorders. So in this video, that's kind of what we'll be covering. We'll really discuss the clusters of personality disorders in the DSM, the basics of each disorder, and some common therapeutic modalities utilized to treat these disorders. So the first cluster being cluster A personality disorders. And so within the DSM, cluster A personality disorders are typically categorized by being more centered around odd thinking and maybe some eccentric behaviors. So the following are considered within cluster A personality disorders. So that would be paranoid personality disorder, schizoid personality disorder, as well as schizotypal personality disorder. So those are within cluster A, and again, just very odd behaviors. Cluster B personality disorders are characterized by being more dramatic and erratic, neurotic. These personality disorders have the greatest amount of social stigma attached to them and are, kind of the up and coming, more popular topics in today. So the following are categorized as cluster B. So within cluster B, we have antisocial, which is that serial killer type personality disorders I described earlier. We have borderline personality disorder. We have histrionic, narcissistic personality disorder. So those are all within cluster B. Cluster C personality disorders, I feel, are not very well known. Same as cluster A, and cluster C personality disorders are typically categorized by being more anxiety and fear-based. So these types of personality disorders can be obsessive and very irrational. So within them, within this cluster is considered avoidant personality disorder, dependent personality disorder, obsessive compulsive personality disorder, not to be confused with OCD, the just separate disorder. So cluster A personality disorder, within the treatments for these disorders, some common ones include CBT, which is really just focusing here on increasing awareness of distorted thinking and exploring some of the assumptions made about society in order to replace them with more adaptive and accurate thinking, given that they usually are, kind of irrational, odd thinking. Psychotherapy is also proven to be very helpful, focusing on learning better social skills, learning triggers, and improving communication, while also learning to be involved in daily activities. For cluster B personality disorders, the treatments also kind of include, but again, are not really limited to CBT. But within this version of CBT, the individual will be learning how to identify their thoughts and feelings while also being aware of their mood shifts, given that they do experience a lot of mood swings throughout the day. So this will grant them the ability to be more proactive in situations where they may have large reactions or swings. This will also assist them in changing their thoughts to shift away from being negative and learn skills to better interact with others and facilitate healthier relationships, given that within cluster B personality disorders, they really do struggle with healthy and long-forming relationships. Again, psychotherapy can prove to be helpful here too. This will assist in bringing more awareness to what society considers normal. This can also assist them in gaining a clearer idea of what a healthy relationship is and how to control impulsive behaviors. Another therapeutic approach that's proven to be helpful is psychodynamic. So this will focus on the individual's unconscious thinking that impacts their behavior. This will focus on raising awareness of the unconscious and recognizing distorted unconscious thoughts. So finally, cluster C personality disorder treatments. Some common treatments for this cluster include, once again, CBT as being very helpful, focusing on how thoughts and patterns affect their responsibilities. So new techniques and skills that are really focused on modifying negative thoughts that lead to the irrational and negative behaviors and emotions. Once again, given that they are very cyclical or irrational, fear-based, this will be really helpful. Finally, psychodynamic therapy can be helpful for individuals suffering from cluster C personality disorders because it will help individuals learn how to identify their perceptions of the situation that worries them, identify reasons why they're worrying, and then address the perceptions of what other people think. In conclusion, personality disorders have a troubling etiology and can scare even clinicians oftentimes. The truth is, much of what evolves is due to trauma. Most personality disorders are, really a product of survival mechanisms that these individuals have learned to utilize from a young age in order to really get by in their troubling situation. Much of these disorders have a great deal of stigma surrounding them and are often misrepresented in media. According to the National Library of Medicine, there is overwhelming evidence that really suggests harmful misrepresentation in media and how difficult it can really impact people with these personality disorders and cause them to feel, outcast or just really, really misrepresented. I can help. Oftentimes, these personality disorders are comorbid with other disorders and can thus be agitated by other disorders. And we can really work together to understand how your personality disorder came about and how we can alter some of the maladaptive survival patterns to be more positive and focus on maintaining a healthy self-image and even healthier relationships. If you think you may be suffering from a personality disorder, first of all, please refrain from self-diagnosing and reach out to a professional. I would be more than happy to discuss your concerns in depth and help you really understand your mind. Please join me in my next video as we really go in depth and discuss cluster A personality disorders, the criteria of what they really look like in general society, as well as some typical types of modalities and therapeutic techniques and interventions that we use to help individuals with cluster A personality disorders. See you then.